Hello everyone, I'm Dr. Thukral and this is my first video of learning Materia Medica with Dr. Ria. My videos are meant for understanding the remedies deeply and forming an everlasting picture in our minds. I've tried to inculcate all the important aspects of a remedy. But as you know very well, Materia Medica is like a vast ocean. It never ends. Suggestions and comments are welcome. Please let me know the goods and bads of my video. It will help me learn and teach better in further videos. So without wasting any more time, today we will be learning a very important medicine of the magnesium group, which is Magnesia Carbonica. In this video, we will be understanding this remedy in detail. We will study what is Magnesia Carbonica, significance of MAC-carb in the old school of medicine, sphere of action, physiological action, constitution with the temperaments, thermal reaction and miasm in the background, etiology of complaints, mental generals, physical generals, characteristic particulars with comparisons, general modalities and the therapeutic application of this remedy. Let's start this video with the most basic question. What is Magnesia Carbonica? Well, this question has an easy answer. MAC-carb is commonly called carbonate of magnesium and it is a medicine belonging to the mineral kingdom. The chemical formula for this salt is MgCO3. The proving data that we have regarding MAC-carb tells us that it was first proved by none other than Dr. Samuel Hahnemann. This medicine is mentioned in his chronic diseases, their peculiar nature and their homeopathic cure, giving us 890 symptoms of the medicine proved by Dr. Hahnemann himself, Nenning and two others. Now let's see how this drug is prepared. Along with the proving data, Dr. Hahnemann has also explained the procedure for preparing this medicine in his book Chronic Diseases. He states that Magnesia Carbonica is a light white friable mass obtained as a white precipitate on mixing solutions of magnesium sulfate and sodium carbonate. It is then washed repeatedly with a quantity of distilled water, filtered and dried on paper. The potencies that follow are prepared by the usual procedure of trituration with which you all are familiar. Now let us come to our next topic, that is significance of Magnesia Carbonica in the old school of medicine. It can be said that this salt of magnesia was not new to the medical profession as a remedy. So how did the physicians of the old school use Magnesia Carbonica? MAC-carb was much used by the allopaths of early times as a purgative medicine. For those who don't know, purgative is a substance used for causing evacuation of bowels. MAC-carb was also used in the form of Gregory's powder, in a combination with rhubarb and ginger, which was used to sweeten the stomach, that is, used as an antacid. From the old school standpoint, properties of MAC-carb are summed up as a laxative, an antacid, and an antilytic. Dr. E.B. Nash writes about this remedy that it was so well known in its action upon the intestinal canal that it was his lady's habitual resort for sore stomach and constipated bowels for a long time. Let's talk about the sphere of action of this wonderful drug. It prominently acts on the gastrointestinal tract, that is, the stomach, bowels, and the liver. Also, its effect is seen on the nerves, especially the facial and dental nerves. There's action on the malar bones and the female reproductive system as well. Would you like to know what effect does it have on these parts exactly? Let me tell you that in physiological dose, this drug produces irritation and catarrh of the mucous membrane of the alimentary tract with acid and sore irritations, sore smelling flatulent stools and sore perspiration. It also causes disturbance in the menstruation by acting upon the female genital organs. By acting on the nerves, it causes neuralgia and sensitiveness. Did you notice something? Yes, there is marked soreness of discharges even in the physiological action of this drug. Another point worth noticing, which might also help remembering the symptoms of this medicine, is that magnesia forms the central atom of chlorophyll and is therefore partially responsible for the green color of plants. And patients who need MAC-carb also show marked green discoloration, on their tongue, in their discharges from nose and throat, and in their stools. Now let's take a look at the constitution of MACAB patients. Think of MACAB when you see a puny, sickly child with defective nutrition and lax fiber. The child will have a marked sore smell of whole body, which cannot be washed away. Or you may come across a broken down, worn out woman with uterine and climacteric disorders. These MACA patients have an irritable disposition and a nervous temperament. This medicine is used in all ages and both sexes, but everywhere we find constitutional debility caused by excesses of cares, anxieties, and worries of life. As stated by Dr. N.M. Chaudhary, the sprightliness, agility, and normal outburst of vitality is wanting. I know you're eager to know the thermal reaction of MACAB. Well, thermally, MACAB is very sensitive to cold air. And now, if we talk about its dominant miasm, Dr. Kent has mentioned in his lectures on homeopathic Materia Medica that MACAB is a deep-acting and long-acting medicine related to the older and deeper psoriatic sickness. Now, let's understand what causes all the ailments in this remedy. You will see that there are ailments from shocks or blows, excess of cares and worries, mental distress, milk, pregnancy, cutting of wisdom teeth, and from dentition. Boric mentions that MACAB is often useful for complaints arising in people who have been taking this drug to sweeten the stomach. Before moving forward, let's quickly revise what we have learned about the properties of MACAB till now. The common name of MACAB is carbonate of magnesium. It is a remedy of the mineral kingdom. It was proved by Dr. Henneman, and the 890 proving symptoms are mentioned in chronic diseases, their peculiar nature, and their homeopathic cure. MACAB is prepared by mixing magnesium sulfate and sodium carbonate. Old school physicians used it as a laxative, antacid, and an anti-lytic. We have also understood the sphere of action of this remedy and its physiological action on the systems, on GIT causing irritation and catarrh of mucous membrane, on female reproductive system, disturbances in menstruation, on the nerves, neuralgia and sensitivity. The constitution of MACAB is a puny, sickly child with defective nutrition and lax fiber, with marked sore smell of whole body which cannot be washed away. Also, a broken down, worn out woman with uterine and climacteric disorders. It has an irritable disposition and a nervous temperament. MACAB is sensitive to cold air. It is predominantly a psoriatic remedy. And lastly, the remedy covers ailments from shocks or blows, excess of cares and worries, mental distress, milk, pregnancy, cutting of wisdom teeth, and from dentition. Now, let's move on to the most interesting aspect of a homeopathic remedy, its mental picture. So the question arises, what is the personality of a MACAB patient? To understand that, we need to learn about the theme of magnesium group of remedies. This is beautifully described in The Soul of Remedies by Rajan Shankaran. He states that the magnesium feeling is that the person does not get the care, protection and nourishment that he needs. He also mentions that it is the state of an infant dependent on the mother for nourishment, care, security and support, but who has been abandoned by his parents. It is the feeling of an orphan. In this regard, Dr. J.T. Kent's famous example of treating orphan children without any results until he discovered magnesium carbonicum is worth mentioning. Now what happens is that there is insecurity due to an unpleasant childhood, which is because of parental quarrels, parental separation or low attention by parents. So at an early age, the child has to learn to stand on its own feet and assert itself. This child either develops a very kind, peaceful attitude or it becomes very quarrelsome and aggressive. For example, consider a child in an orphanage who is deeply affected by the emotional pain of separation from the parents. It feels lonely and has to fight for respect and recognition in the group, becoming violent and aggressive. But what happens with them later in life? With passing years, you will see that there is a suppression of the aggressive side, and these people now behave in an opposite manner. They become peaceful and non-aggressive. They now avoid quarrels. It upsets them. There is a fear of aggression or violence. They can be described as the peacemakers. Although they do experience increasing attacks of anxiety, which is nothing but the reflection of the fear that originates from their childhood experiences. Fear of losing their partner or the person who looks after them. The peculiar thing to notice in this remedy is that this anxiety is experienced only during the day. It disappears as soon as the patient is in bed in the evening. So you see, the mental genres of a MACA patient can be described by feeling of an orphan, unpleasant childhood, either aggressive or peaceful, peacemaker, intolerant of quarrels, confrontations or disharmony, fear of aggression or violence, anxiety and fear of losing partner or the person looking after them, anxiety only during daytime. Now, let's take a look at the characteristic particulars and guiding symptoms of this remedy. A nerve exhaustion is seen in the patients needing this remedy with great sensitivity. We can understand this by the fact that the water containing magnesia is soft to feel and was used in the form of baths to have a soothing effect on the nervous system. Often it is seen that the physical characteristics of substances correspond with the dynamic influences. Similarly, with this remedy, it is required for nervous systems that need a permanently soothing influence. Remember, Macab is to exhausted nerves what China is to exhaustion from loss of fluids. The whole body feels tired and painful, especially the leg and feet, which are aching and restless. These patients are extremely sensitive, both bodily and mentally. How is this sensitivity manifested? You will see that the slightest touch causes startling, slightest noise irritates, slightest pressure aggravates almost all symptoms, and the slightest exposure of draughts of cold air brings on great sufferings. Further, this sensitiveness passes into neuralgic pains of the highest intensity. What are these neuralgic pains like? There is lightning like neuralgia, aggravated on the left side, insupportable during repose. The patient must get up and walk about. The patient is obliged to run from room to room all night on account of the pain. As soon as the patient stops, the pain returns. Belonging to the magnesium group, Macab is a great pain producer, consequently a great pain reliever. The provers felt these pains mostly in the head and face, but clinical experience has shown that it has violent neuralgia everywhere. It is also a great remedy for tearing, digging, boring pain in the malar bone, also called prosopalgia. The pain too becomes insupportable during rest and keeps on driving him from place to place. Talking about pain, Macab is also a great remedy for toothache, particularly affecting the teeth and roots of teeth. This toothache at first sight seems to be like that of mercury. It comes in decayed teeth and is worse at night. So what's the difference between them? Well, what distinguishes these two remedies is that mercury is worse from warmth of bed and Macab is worse from quiet. The patient is obliged to walk about for relief. Macab is also indicated for this type of toothache during pregnancy, comparable with a remedy that we hardly think of for toothache, which is Retania, having exactly the same symptom. The symptoms related to toothache that we see in this remedy are tearing pains in left side of face, although roots of teeth are perfectly sound. The teeth are so sensitive that they cannot be manipulated by the dentist. He cannot bite upon the teeth. The teeth feels too long. There are bad effects of cutting wisdom tooth. Also, there is toothache before and during menstruation. Another important characteristic of this remedy is the sleeplessness. We see that there is sleepiness during the day and sleeplessness at night. The patient feels so tired in the morning as if he has not slept at all. He is more tired on rising than when retiring, and it takes some time for him to really feel awake in the morning. Coming back to the soreness of this remedy, This soreness runs through the length and breadth of MACA. The stools, the vomit, the sweat all have an acid taint in them. Dr. N.M. Chaudhary considers the absence of this symptom as a great contraindication for MACA. The MACA baby smells sore like the Hipar baby. Wash as much as you want and it still smells sore. The perspiration, the whole baby smells sore, not especially the stool. This can also be compared with rheum and sulfuric acid, both remedies having a sore smell of whole body. Further, Dr. J.T. Kent in his lectures on homeopathic materia medica states that there is a kind of marasmus that you will puzzle over if you do not know this remedy. Let's see how this marasmus presents itself. This remedy produces a state of the body like that prior to tuberculosis. The patient loses flesh, muscles become flabby, as if some serious disease were coming. In children of tuberculous parentage, there is the tendency to go into marasmus. Child will not thrive in spite of feeding and medicines. It emaciates and the back of the head begins to sink in. What else you see is that appetite for milk, meat and animal broths increases, and yet they are not digested. An important characteristic of this remedy being inordinate craving for meat in children of tuberculous parentage. Other desire seen in a MACA patient is for fruits, acids and vegetables. Let's now consider the main seat of action of MACA, the affections of GIT. Let's understand them in detail. This medicine is indicated for the spasmodic affections of stomach and intestines. There will be cutting pain around the navel, distension of abdomen, audible rumbling and gurgling followed by stools. Most importantly, how are these stools like? The stools are green, watery, frothy with green scum like that of a frog pond. Sometimes large masses of white tallow-like substance floating in the green watery stool is also noticed. Another thing to remember is that the diarrhea occurs regularly every 3 weeks. The green color, the soreness and the froth are the 3 distinctive characteristics of the stool of this remedy. Milk is intolerable to them and it is passed out in the stools in the form of curd, especially in the nursing children. The stools of MACA are preceded by gripping doubling up colic. In such colic, you will notice that it is difficult to choose between MACA and colocynth. But Dr. E.B. Nash explains that the stools of these remedies are not alike and that will help you to differentiate. Further, rheum and MACA both have colic before stool, sore stool and sore smell of the whole body. But the green stool is more marked for magnesia and the soreness is more marked for rheum. Also, the stool of rheum is more often dark brownish than green. Another remedy worth comparing here is chamomilla, which has green stool and much pain, but the stools are watery, while that of MACA are slimy. MACA is also similar to calcarea carb. Both have sore stool, rejection of milk, and imperfect nourishment of body. However, calcarea can be distinguished with the help of its characteristic sweat on the head, face, and scalp, damp and cold feet, and an enlarged abdomen. The magnesias may also produce inactivity of rectum and anus, or paresis. Stool is large, dry, hard, requiring great straining to expel. It will remain partly expelled and then crumble, breaking up in many pieces. There is tendency to constipation after a nervous strain in MACA. Very important for you to know is that an adult MACA patient suffers from acid dyspepsia. Food such as cabbage and potatoes, starchy food are indigestible. There are sore belching, eructations, taste and vomiting. Also, MACA is indicated for affections of pregnancy, mainly for nausea, neuralgia and toothache of pregnancy. So what we know about the GI symptoms of MACA is that there are spasmodic affections of stomach and intestine. Patient presents with cutting pain around the navel, distension of abdomen, audible rumbling and gurgling followed by loose stools. Stools are green, watery, frothy with green scum like that of a frog pond. Diarrhea occurs regularly every 3 weeks. The green color, soreness and the froth are the 3 distinctive characteristics of the stool of this remedy. The stools of MACA are preceded by griping, doubling up colic. MACA patient suffers from acid dyspepsia. There are sore belching, irritation, taste, and vomiting. Also, maca is indicated for affections of pregnancy, mainly for nausea, neuralgia, and toothache of pregnancy. Now, what about the action of maca on the female reproductive system? The menses we have under this remedy are late and scanty and have this peculiarity that they flow more at night while the patient is at rest, becoming scanty while the patient is up and moving about in the morning, ceasing altogether later on in the afternoon. Remedies like ammonium mure and creosote show similar symptoms, while lilium tick and causticum have the opposite of it. Remember that in all sorts of magnesia, menses are dark and pitch-like. The patient may tell you that before menses, she develops coryza, sore throat, and labor-like pains. She says, I know my menstrual period is coming on because I have cold in my head. Also, the patient is generally worse during menses. Maca also has its action on the muscles and joints indicated for rheumatism in the right shoulder. Right shoulder is painful and the patient cannot raise it. There are rheumatic pains in the limbs which are worse after a long walk in bed and better from warmth. Sanguinaria too has rheumatism affecting the right deltoid muscle, while nux moschata is indicated in rheumatism affecting the left deltoid. You must know that the tumors and bony growths also have yielded to maca. Dr. J.H. Clark had cured with it a tumor of the right malar bone in an aged sea captain on whom he tried various other remedies but without much avail. How Dr. Clark came to the selection of this remedy is an interesting study mentioned in his Dictionary of Practical Materia Medica. The symptoms he considered to select maca were throbbing pain in the antrum of Highmore with swelling of the right malar bone, facial neuralgia, left-sided shooting like lightning, aggravation by touch, drought, change of temperature, cannot stay in bed, must walk the floor. Dr. William Burick too mentions affections of antrum of Highmore in the symptomatology of maca. An important symptom worth mentioning is a peculiar sensation in the face as if it has been smeared over with the white of an egg. Now let's quickly summarize the characteristics of maca that we have learnt in this lecture. Constitutional debility brought about by the excesses of cares, anxieties and worries of life. Sensitiveness both bodily and mentally to touch, pressure, draughts of cold air and change in temperature. Maca is to exhausted nerves what China is to exhaustion from loss of fluids. Aggravation of all symptoms from rest, amelioration from walking about. Lightning like sharp, unbearable neuralgias worse at night. Toothache during pregnancy worse at night. Sleepiness during day, sleeplessness at night. He's more tired on rising than when retiring. Extreme acidity and soreness which runs through the whole remedy. The maca baby smells sore. Wash as much as you want, it still smells sore. Inordinate craving for meat in children of tuberculous parentage. Cutting pain around the navel, audible rumbling and gurgling followed by diarrhea. Green frothy sore diarrhea appearing like green scum of a frog pond, aggravated every 3 weeks. Milk intolerable passed out in the stools in the form of curd. Menses flow more at night while at rest, scanty in morning and ceasing in the afternoon. Menses are dark and pitch-like. Before menses, there is coryza, sore throat, labor-like pains, rheumatism in the right shoulder, affections of antrum of Highmore, sensation in the face as if it has been smeared over with the white of an egg. The general modalities of this remedy are aggravated at night, rest, noise, starchy food, milk, every 3rd week, change of weather, cold drafts and during menses, amelioration by warm air but worse in warmth of bed, motion, walking about and open air. Looking into the relationship of this remedy, we find that maca is complementary to chamomilla and antidoted by rheum, myrrh, arsenic, nux vomica and pulsatilla. Moving on to the last topic of this video, let's know about the therapeutic application of this remedy. As mentioned in a manual of Materia Medica, Therapeutics and Pharmacology by Blackwood and Alexander Leslie, under this remedy, we see that therapeutically It is indicated in catarrhal enteritis, where the stool is the characteristic green scum upon the frog pond. It has been useful in cases of acid dyspepsia with heartburn, when there is marked acidity of gastric and intestinal secretions with a constant sour taste in the mouth. It is also beneficial in sick headaches when there is a persistent nausea, vomiting of extremely acid material. At times, this may take the form of a supraorbital or infraorbital neuralgia. The pains are sharp, shooting in character. This pain in vertex as if the hair were pulled. Worse at night during rest so that the patient gets up and walks about. Patients also worse from a draft of air, change of temperature to cold, and from touch. It should be considered in marasmus of children. They are puny, sickly, milk causes colicky pain in the stomach, and the stools are green and sore. It is helpful in delayed and scanty menstruation and in menorrhagia when the flow is thick and dark like pitch and is worse at night. So that's all for Magnesia Carbonica. Hope this lecture fulfilled its purpose and helped you in understanding this remedy deeply. Thank you. Keep learning.